Imagine this. You're out on a crisp autumn afternoon, walking your dog, when a strange heaviness grips your chest. It's not sharp pain, but a tight, uncomfortable pressure that makes you stop and catch your breath. You lean against a tree, wondering if it's just indigestion or being out of shape. The feeling fades after a few minutes, and you're tempted to shrug it off. But this is your heart sending a warning, a signal that shouldn't be ignored. This scenario is common. It happens to people every day, often during exertion or stress. The pain isn't random. It's your heart muscle asking for more oxygen. Think of it as a warning light on your car's dashboard. You wouldn't ignore it and keep driving. Your body deserves the same attention. That fleeting discomfort is your chance to listen and act. It's the start of a conversation with your health. Recognizing and responding to these signals can change the course of your life. Don't dismiss what your heart is trying to tell you. This is the first step toward protecting your future. So, what is angina? It's not a disease, but a symptom, a warning sign from your heart. The word angina means to choke, describing the squeezing sensation many feel. Angina happens when your heart muscle isn't getting enough oxygen-rich blood. The coronary arteries, your heart's fuel lines, can't keep up with demand during exertion. This temporary shortage, called ischemia, triggers the pain. The pain is your body's alarm, forcing you to slow down. Rest usually relieves it, as your heart's oxygen needs drop. Unlike a heart attack, angina doesn't usually cause permanent damage. Think of it like a garden hose with a kink. Fine for a trickle, but not enough when you need more. When you push your heart, narrowed arteries can't deliver, and your heart protests. Angina is a clear signal that your heart's fuel lines need attention. Don't ignore it. What narrows those vital arteries? The main culprit is atherosclerosis. Over years, cholesterol, fat, and other substances build up as plaque inside artery walls. This buildup hardens and narrows arteries, restricting blood flow. Risk factors like high cholesterol, high blood pressure, smoking, and diabetes speed up this process. You might feel nothing for years, until the narrowing becomes severe. When an artery is about 70% blocked, angina can strike during exertion or stress. The pain is your heart's response to being overworked and underfed. Plaque can be stable or unstable. Unstable plaque can rupture, causing a blood clot. If a clot blocks the artery completely, it leads to a heart attack. Angina is a warning. Your heart is at risk. Take it seriously. Angina isn't one size fits all. There are different types, each with its own risks. Stable angina is the most common, predictable, triggered by exertion, and relieved by rest or nitroglycerin. The pattern is consistent, making it manageable but still a sign of underlying disease. Unstable angina is unpredictable and dangerous. It can occur at rest, last longer, and may not respond to rest or medication. A change in your usual pattern, more frequent, severe, or occurring at rest, signals unstable angina. This is a medical emergency. A heart attack could be imminent. Variant angina, or Prinzmetal's angina, is less common. It's caused by a spasm in a coronary artery, often at rest, and usually relieved by medication. Unlike the others, it's not due to plaque, but a temporary narrowing. Knowing the type of angina helps guide treatment and urgency. If symptoms change, seek help immediately. Your heart's warning signs matter. The classic angina symptom is chest pressure or pain, often described as a heavy weight or tight band. This discomfort can spread to the shoulders, arms, neck, jaw, or back. It's usually a deep ache, not a sharp pain. Shortness of breath, sweating, or a sense of unease often accompany it. But not everyone experiences angina the same way. Women, older adults, and people with diabetes may have atypical symptoms: fatigue, nausea, indigestion, or breathlessness. Some may not feel chest pain at all. Any new, unexplained upper body discomfort with exertion that eases with rest should raise concern. Don't ignore persistent heartburn, unusual fatigue, or sudden breathlessness. When in doubt, get checked. Your heart may be sending a subtle SOS. When you see a doctor for chest discomfort, they become a detective. Your story, what you feel when it happens, what relieves it, is the first clue. A physical exam and questions help rule out other causes. An electrocardiogram, EKG, records your heart's electrical activity and can show signs of ischemia. Sometimes a resting EKG is normal, So a stress test is used to see how your heart responds to exertion. If you can't exercise, medication can simulate the effect. If tests suggest coronary artery disease, advanced imaging like a coronary angiogram may follow. This uses dye and X-rays to pinpoint blockages. Other tests, like cardiac CT or nuclear stress tests, provide detailed pictures of blood flow. Accurate diagnosis is key to the right treatment. Treating angina aims to relieve symptoms, slow artery disease, and prevent heart attacks. The foundation is lifestyle change, a healthy diet, regular exercise, quitting smoking, and managing stress. Medications are crucial. Nitroglycerin for quick relief, beta blockers and calcium channel blockers to reduce heart workload, and aspirin to prevent clots. Many people manage well with these steps. If symptoms persist or blockages are severe, procedures may be needed. Angioplasty with stenting opens narrowed arteries. For multiple or complex blockages, bypass surgery creates a new route for blood flow. These treatments can be life-saving and restore quality of life. The right plan depends on your unique situation. The best approach to angina is prevention. Start with a heart-healthy diet, plenty of fruits, vegetables, whole grains, and lean proteins. Limit processed foods, sugary drinks, and unhealthy fats. Regular physical activity, at least 150 minutes a week, strengthens your heart and improves cholesterol and blood pressure. Even small changes like walking more or taking the stairs add up. If you smoke, quitting is the single best thing you can do for your heart. Your body starts healing the moment you stop. Managing stress is also vital. Chronic stress raises your risk. Find healthy ways to relax, like mindfulness, hobbies, or time with loved ones. Don't hesitate to seek help for quitting smoking or managing stress. Prevention is about daily choices that add up over time. Your heart will thank you. Protect it now for a healthier future. Angina is a wake-up call, a chance to listen and act before a crisis. Recognizing symptoms and seeking help empowers you to take control. Modern medicine offers powerful tools, medications, procedures, and lifestyle changes. Many people feel better than ever after treatment and positive changes. Your heart is resilient and can heal with the right support. Think of prevention and treatment as investments in more time, energy, and joy. Every healthy choice strengthens your future. Don't ignore symptoms. Reach out to a healthcare professional. Early diagnosis and action make all the difference. With knowledge and commitment, you can thrive and enjoy life with a healthy heart.